gynecology. So today's topic of the discussion will be about the in vitro fertilization, and in this video I'll be talking of one of the very important methods of in vitro fertilization, which is called as the intracytoplasmic sperm injection. So in this video we'll be seeing it as to what is this intracytoplasmic sperm injection and in what cases do actually this intracytoplasmic sperm injection is required, what all men or in what all treatment modality it is required. Apart from this, who are the people, who are the individuals who do require this intracytoplasmic sperm injection, and which are the people and how this procedure is being carried out. So viewers, starting with this intracytoplasmic sperm injection, it is an effective treatment modality for the men who are having certain fertility issues. So it is mostly required for men with infertility problems, and actually it involves the sperm to be injected directly into an ovum so that it can get fertilized. And in certain men whom actually the sperm cannot be they cannot ejaculate the necessary amount of the sperm. So in cases of certain kinds of azoospermia or certain medical conditions where they are unable to conceive through a normal sexual intercourse due to the lack of sperm in their semen. So such men with such male fertility issues, they are their treatment method, that this is the intracytoplasmic sperm injection. This method helps them to conceive. So actually beginning with, so this type of as I've already said, so actually there are two things. First, it is the in vitro fertilization, and the other is the intracytoplasmic sperm injection. So as you people might be aware that this in vitro fertilization, it is a method in which in a laboratory the eggs are being fertilized, and this ovum or the fetal or the egg what is there, it is taken in a petri dish and it is surrounded by numerous sperms. So numerous sperms are surrounding a single ovum, and if chance occurs, one of the sperm is going to fertilize to the ovum and the embryo can be formed. But in case of intracytoplasmic sperm injection, what do we find is that a single ovum is taken and it is fertilized with the help of a single sperm. This single sperm is going to penetrate into the cytoplasm of the ovum, leading to the process of fertilization and later on the formation of an embryo. So actually, it is absolutely either it be the in vitro fertilization where numerous sperms are surrounding a single ovum, or it is the case of intracytoplasmic sperm injection where a single sperm is going to fertilize a single ovum. The fertilization process or the formation of the zygote, it is purely a chance. So it does not necessarily mean that whether it be the IVF or be the intracytoplasmic sperm injection, this does not make it sure, it does not makes it confirm that the fertilization will 100% occur. There might be a possibility that the fertilization can occur and the formation of zygote can take place. So this is not a confirmatory method that 100% fertilization is going to take place. The fertilization process, as in a natural conception, it happens, it occurs just by chance. Similar is the case here in these two modalities, that is the IVF as well as the intracytoplasmic sperm injection. So actually in this video we'll be looking at as to who are the individuals who require this intracytoplasmic sperm injections. So most importantly, this intracytoplasmic sperm injections, it is required by such men who are facing issues in normal natural conception, that is they are unable to they are having certain kind of problem into the male genital tract, and this kind of a problem in the male genital tract is making them inefficient to so that they can conceive through a natural sexual intercourse. So actually most men who are suffering from male infertility problems due to one or the other causes, uh, they are they are the candidates who should go for this intracytoplasmic sperm injection. So mostly the healthcare professionals, they recommend this intracytoplasmic sperm injection if a person has, the first important condition is that first what they are going to do is that a person who is having an ejaculation, means there are certain men who are unable to ejaculate, and actually they have an inability to ejaculate. So once if they are unable to ejaculate their semen into the female reproductive tract, so ultimately they cannot fertilize through a natural conception. So what is going to happen is, so the first candidates, the first individuals, the first type, who are the individuals who are more who should be who are the eligible candidates for this ICSI, it is the people who are suffering from the problem of an ejaculation, that is they are unable to ejaculate their semen. The next important thing is that whether there is occurring some kind of a blockage into the male reproductive system. So in the male reproductive system, either in any of the parts, whether it be the vas deferens, the ejaculatory duct, the seminal vesicles, something or the other is causing a blockage in their male reproductive tract. So these are the individuals who should try, who become the eligible candidates for the process of ICSI. Apart from this, there are men who are suffering from low sperm count. So so this becomes another third important point, that since it is a male infertility issue, so actually the men who are having a low sperm count are going to suffer from this. They can opt for ICSI. Apart from this, there are certain men who have a poor sperm quality. The quality of the sperm is not that well that it can fertilize through a natural conception. So actually such men, they can opt for ICSI process, that is intracytoplasmic sperm injection. And apart from this, there are certain men who have the issue of retrograde ejaculation. So actually in retrograde ejaculation, what happens is that once they are having the process of sexual intercourse, their semen is going to flow back into the bladder. So such men with such a male fertility issue, due to such reasons, if they are having, so they can opt for the process of intracytoplasmic sperm injection. Apart from this, other cases where the intracytoplasmic sperm injections can be done. So first important thing is that if the traditional in vitro fertilization has failed and it has failed to create an embryo, so in such cases the ICSI stands the treatment modality. Apart from this, there are certain women who are above a particular gestational age. So actually the women who are conceiving, who are trying to conceive above the age of 35 years. So 35 years is a very great age, and after the age of 35 years it becomes very difficult for the woman who is trying to conceive. So in such cases, the persons who are suffering and who are supplying the eggs is of the age of 35 or above. So in such cases, they can also opt for the process of ICSI. Apart from this, there is in certain cases that this intracytoplasmic sperm injection, it also holds good for such candidates who are having the previously frozen their eggs. So actually now you must have known that the Indian Bollywood actress Priyanka Chopra has got her eggs frozen at the age of 30 years. So there, for this intracytoplasmic sperm injections, the eligible candidates are those also who have their eggs frozen previously, or their sperms being preserved previously through the method of cryopreservation. So there are certain individuals who try to preserve their eggs and sperms, and they also are the potential and the able candidates for, they can opt for the intracytoplasmic sperm injection. So actually, when looking at the success rate, so when we talk of the success rate, it has been found that out of the 10 in vitro fertilization method, 6 in vitro fertilization methods, they are actually doing the ICSI. Alright, apart from this, when we look at the success rate of the intracytoplasmic sperm injection, it has been found that 50 to 80% of the cases of intracytoplasmic sperm injections, they have chances of success, where in artificial medium, in a laboratory petri dish, the ovum and the sperm are getting fertilized, intracytoplasmic sperm injections process has been carried out, and that leads to the formation of an embryo. Now, so this was a very short video where I have tried in simple words to tell you that what is this intracytoplasmic sperm injection and how is it different from the traditional IVF. So, and actually in this video also I have discussed that who are the potential candidates who can opt for this intracytoplasmic sperm injection. Just a quick review. Firstly, the persons who are having difficulty or having the inability to ejaculate, that is, and the people who are suffering from the problem of anejaculation. Apart from this, whenever there is any kind of an obstruction in the reproductive tract, these persons who are suffering from an obstruction in their male reproductive system, so they can be the potential candidates. They can opt for the ICSI. Apart from this, if the sperm quality is poor, they have low sperm count, and they either if they are having suffering from the problem of retrograde ejaculation, so such people, they become the eligible candidates, and they can opt for, if they are unable to conceive, they can opt for this ICSI. If the donor eggs from the maternal side or from the women's side, if the maternal age has exceeded 35 years, so they can also opt for this method of in vitro fertilization. And actually, this intracytoplasmic sperm injection method, it is mostly done in such cases where the traditional in vitro fertilization process has failed, or in people who are trying to conceive through cryopreservation, who have got their eggs frozen or their sperms frozen through cryopreservation. So viewers and students, this was a very short discussion where I've tried my level best to simplify that what is the difference between intracytoplasmic sperm injection and in vitro fertilization, and who are the potential able candidates who can opt for this intracytoplasmic sperm injection. So students and viewers, if you still have any queries or comments, you're most welcome to comment me in the comment section. And if you like this video, give this video a thumbs up. For students who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.